Wabarakatuh. Welcome to the King Hamad University Hospital, and we're here, and it's World Epilepsy Awareness Day.
That's
Dr.
the
Hamad?
World's Epilepsy Awareness Day. We're celebrating it today. We're supposed to celebrate it on the 26th, but the 26th is not a working day, so
Right,
we're gonna
right,
celebrate
right.
it.
Right, inshallah. We're going to be going through some stations over here, and they're going to be giving us an idea of.
So we have 4 stations. The first station is gonna be about how or what is epilepsy, a brief idea of what is epilepsy, and the second station is gonna be about rescuing a patient with seizures. The third station is gonna be about diagnosis and treatment, and the fourth station will be a competition. Just test yourself, and if you get the answer right, you're gonna get a free coffee. He's my best resident. He's
MashaAllah.
the most hardworking
Hella,
guy.
hella, hella,
And
hella.
you know this guy, if I was to go to war, I will take him with me.
MashaAllah, MashaAllah.
How many viewers عندنا؟ 106.
Yeah,
Nice.
Just starting off, inshallah. So over here is what we have over here? What is epilepsy?
Yeah.
Please help us out.
Hi. What is that?
Come over.
We're live streaming at the moment, and we're just
Yeah.
trying to give folks an idea of
Hi, this
what's
is
going
Dr.
on.
Amina from King Hamad University Hospital. Today we have an epilepsy awareness campaign. Actually, it's the 26th of March, but we are celebrating today for we encourage awareness of this disease. The first station is what is epilepsy. It's actually an abnormal activity, electrical activity in the
Right,
brain,
right.
which might lead to abnormal behavior.
Right.
Okay. Those abnormal behaviors could be, for example, shaking movements or loose consciousness. But what we should know as well, not all of them, they might have similar picture, like losing their consciousness or having some stiffness in their limbs.
Right.
Some people they would stare only to one place,
Right.
and some people they might.
It's focal. صح؟
It's a focus.
Focal هذا هو. I'm learning. Oh, shukran. Thank you. Thank you.
Actually, those people who lose their consciousness, they
Yeah.
have activity all around the brain.
Right,
But
right.
فإحنا نسميه هذه Arabic or English?
English, yes,
English.
it's most
So we call this a generalized seizure.
Right.
Okay. However, the focal seizure, it affects only one place of the brain.
Right.
يعني not always should be here. Sometimes here, sometimes here.
Right,
It depends.
right.
Okay. But those with partial seizure, they don't lose their consciousness. So we have to diagnose them right. Those patients, they
A
might.
bit slower, sister. Just a bit slower.
Okay, so we have to diagnose them right. Those people who have focal seizure, because they may present differently. The
Right.
presentation could be just staring to one place.
Right.
Some people they might smell something abnormal, like a burning smell. Some people they will hear
Right.
something like a ringing bell.
Right.
Okay, so those people also have to be diagnosed, so we can order for us and to help them. Okay?
Right.
There are some triggers to seizure, like fever, any febrile illness, if the patient is not complying to get the medications. Some certain medications as well might lead to having a seizure, and
Understood.
stress, not sleeping enough. All of
Okay.
that can trigger a seizure.
Okay,
All
okay,
right.
okay.
So we have the next station there. I would like you to know how to rescue a patient in public. I
Sounds
want
good.
people to stay calm. I want people to help the patient seizing in front of them, and we want we want everybody to be cooperative. So that's why our logo today is stronger together. So the patient will need the public around him to support him and to understand the illness itself. Right?
Thank you, doctor.
Thank you.
And then we have some folks online, and they're just wondering about epilepsy and at the moment how to rescue. What's going on?
Okay,
What do we need to know?
So this station talks about how you can rescue a patient with epilepsy in case a seizing episode starts. First, you should stay calm, do not panic, and then you should make sure that the environment is safe and there is nothing that could harm the patient himself. After that, you should time the beginning of the seizing episode and put the patient on his side. Why? To prevent the vomitus and saliva coming back to the respiratory tract.
Okay.
That could cause him choking.
Okay.
Then do not try to restrain his movement or introduce anything in his mouth, either fluids or food, and stay with him till the episode is done. In case it lasts for more than 5 minutes, you can call the ambulance.
Okay.
That's it mainly.
That's mainly it.
It's a few things, and sometimes
Right.
you become stressed, you forget these things.
So what's the idea of taking the time? Why take the time of when it's happening?
Because after 5 minutes, the state is called status epilepticus.
Okay.
This is an emergency. The patient needs medications to stop the seizure.
Okay.
That's
okay.
why it's important to transfer the patient to the emergency.
I see. So if it's under 5 minutes, then
It's fine.
all right. Okay, thank you. I have a live stream at the moment, and folks are wondering about epilepsy and what's up with diagnosis. How does one diagnose epileptic patients?
Okay, the diagnosis is mainly on history of the patient, what happened before the convulsion, during and after, and we can use some sort of brain scans in order to help us to diagnose epilepsy,
Okay,
like EEG,
Okay.
brain MRI, PET scan.
right.
For the treatment, it's mainly on oral medication that control the seizure and the epilepsy itself.
Okay,
Around 2/3 of the patients will respond to oral medications.
okay,
The other 1/3 of the patient who will not respond, we might refer these patients to more specialized centers for like brain surgery.
okay. Other methods of diagnosis?
It's mainly clinical diagnosis,
Okay.
like on history and
Yeah.
clinical examination.
Yeah,
And as I told you, you have EEG
Yeah.
for the brain, CT brain, MRI, these all that can help us to exclude other causes like brain
Okay.
tumors.
okay.
So,
Can you give me an idea of history? What do you mean by history?
okay, so it's better that someone who witnesses the seizure itself. Like, what did the patient feel before the seizure? Did he smell anything?
Okay,
felt,
okay.
Or deja vu?
Right.
Yes. During the seizure, the movement itself, he lost his consciousness, any tongue biting, any urine incontinence, and what happened after, and the duration of the seizure itself.
All right.
This is the history.
All right.
And there is a video, this will help us a lot.
Understood.
So that's why we recommend whoever sees someone who's seizing in front of his eyes to take a video.
Right,
So the doctor
right.
can see what's happened.
Right.
exactly.
All right. Thank you. Next station is
So the next
Mashallah.
So the next station is pick a question. So I picked one.
Okay.
So the question is, list one epilepsy investigation.
Folks, help me out.
Let's see the answer. Let's see what they say.
One more time, Akhi.
List
Thank
one,
you, doctor.
Yeah, list one epilepsy investigation. So I'll help out. So we have
Give them a chance.
Okay.
Because there's a bit of lag. Here. But by investigation, what do you mean exactly by investigation?
So could be blood tests, some imaging.
So
some
through history?
questions. Yeah,
History, for example?
Exactly.
History, guys. Hey. Okay. What else is there?
So one of the investigations is EEG. We just
Right.
check
Right.
the electrical activity in the brain.
Right.
So that's one of the questions.
Let's go. This question is two triggers for having a seizure.
Two triggers for having a seizure.
Seizure incidents.
So you mean by two triggers, as in physical side effects, or what do you mean by triggers?
Fever.
Okay.
Okay, that's one.
Okay.
Like things that will get the patient to have the seizure.
Oh, okay. Stress.
Stress, yeah.
Yeah, okay.
You said it as well.
Alhamdulillah. Lack of sleep.
Yeah, that's
Okay.
a good one.
What else?
Yeah. One that's really important is taking the medication in the right time.
Right.
Like even delaying it for 2 hours can be critical.
Right.
Patients can be more predisposed to have this episode.
Okay.
So you'll have to take them like in the right time. Be punctual about the medication.
Understood.
I have to steal a cookie over here. They're really good.
And that's it for whoever that can come. They should come to get more awareness about it.
Yeah, Doctor. I always want you to be around for the questions.
Of course.
So it's just some general questions. What are early signs of epilepsy?
So, epilepsy can manifest in very different ways.
Yep.
You can have initially a generalized seizure or a focal seizure.
Yeah.
And before having a seizure, if it was a focal seizure, you're going to have an aura. Auras differ according to the site from where the epileptogenic focus is. So the commonest type of focal epilepsy is temporal lobe epilepsy. And the common types of auras that patients can have before a temporal lobe epilepsy is something called an epigastric rising sensation. You
Right.
feel that there is something rising.
Right.
You can have fear, you can have palpitations, you can have a sensation of a deja vu. A deja vu means something new that seems familiar or feels familiar.
Right. Right.
Then you can hear some things. Sometimes you can have hallucinations, but these are not very common. The commonest thing is the epigastric rising sensation. Okay?
Someone's asking, can it be genetic?
Of course, one of the major causes of epilepsy is genetic. So epilepsy itself can be genetic, can be metabolic, can be structural, can be immune mediated, and can be from an unknown cause.
Right.
So before a generalized seizure, you might have a prodrome. A prodrome is like you for 24 hours or for a few hours, you'd feel abnormal, either tired or having a headache. You just feel that you're not yourself.
Right.
This can happen before a generalized seizure. Before a focal seizure, you would have the aura, and auras do not last for a long time.
Right.
They last for seconds or minutes.
Right.
And they themselves are now called seizures because you do not necessarily have to have a motor seizure.
Right.
Seizures can be behavioral, can be emotional. There are different manifestations for seizures.
Right. Someone's asking about where is it? How can you understand absence seizures?
Absence seizures are seizures that usually occur in children.
Right.
And what happens is that you would be talking with them and they would be responsive, and suddenly they become unresponsive.
Right.
They stare, and that there's a blank stare, and then it lasts for a few seconds usually, and they return back to normal, as if connection is cut down for a few seconds, and then connection comes back.
Okay.
In adults, what we have is something called behavioral arrest seizures, and these are different and have a different localization. Behavioral arrest seizures occur with temporal lobe epilepsy, usually.
Right.
Absence seizures are generalized seizures where the electric activity is from within the entire brain.
Right.
So, some motor manifestations can be present in absence seizures sometimes, but rarely. In behavioral arrest, you might find something called automatisms, which are like hand-picking movements, or chewing, or swallowing.
Right.
In absence, you won't find these. It's just a stare and a disconnective.
Hello, Hassan.
Our
Dr. Hassan.
ENT professor.
Hi. Please carry on.
Yeah, that's the answer for the question.
All right. Signs of epilepsy outside of the seizures. There's quite a...
There are things that can happen. For example, if you have temporal lobe epilepsy, you can have problems with memory. If it's in the dominant temporal lobe, which is usually the left temporal lobe, you will have problems with something called verbal memory.
Okay.
And if it's in the non-dominant temporal lobe, you'll have problems with the visual memory.
Right.
So remembering words, remembering spoken language is more with the left side, usually. And remembering visions, visual, whatever you see, is more with the right side, the non-dominant. In certain people, you can have paresis or weakness after a seizure, especially if it's in the primary motor area in the frontal lobe.
Okay.
You can have personality changes sometimes as a result of recurrent seizures. If you have a focus, which is like a tumor, or a large focal cortical dysplasia, an abnormality within the brain, that abnormality can give you signs and symptoms depending on where that abnormality is.
Right. Like when we think of some specific diseases, it usually ties to like one part of the body. But why with epilepsy is it tied to so many different things?
Because the brain controls almost everything in the body and has variable functions.
Right.
Therefore, you'd expect that.
Right.
You have areas that are responsible for movement.
Right.
Areas that are responsible for sensation.
Yes.
Areas that are responsible for memory, for vision, for a lot of different things, for personality, for even initiation of movement, for, controls the entire body. So if you have dysfunction within a certain region within the brain, you're gonna have an abnormality related to that dysfunction.
Okay. So that due to that, there's a large variety because it's tied to the brain. There's a large variety of symptoms. And
Exactly.
right. So this question is, what if Apus has a seizure and anxiety attack? Then you need to, yeah, Habibi, serious questions, guys, serious questions.
Apis. What is Apis? Is he an ape?